I am here with Dr. Surajit Khanna, our standing guest on the voiceofthekids.org radio show. We're here 3 days a week, Tuesdays, Wednesdays, and Fridays. And this week we have a wonderful guest, a good friend of mine, Susan Levin. And I knew her when her husband unfortunately has passed, Dr. Warren Levin, the East Coast Dean, he was called, of alternative medicine, actually integrative medicine. I have had a wonderful relationship with Susan. She continues to be in the medical field. She continues to do some work. And Susan, rather than me trying to fumble through, why don't you give us some background so we can begin our talk?
Okay. I have been involved in the field of complementary integrative functional medicine for well over 35 years. I've studied, I have trained, I've attended conferences, I've been involved on many levels in practices, not just with my husband, but in other physicians' practices. I've been involved in an FDA study, and I've worked with children, did a lot of work with my husband with children on the autistic spectrum, and with incredible results, which is so exciting. So I work in a very unique way. I do a lot of in-depth work. I will spend as much as 4 hours poring over my clients' labs and their issues and their symptoms, and then I work and develop a master plan. There's no one else in the country doing it, and there are times where I have to spend 10 hours doing this, and then working out a plan, and then working with a functional medicine practitioner. But one of the things I think is so relevant, and my title is Advocating for Children.
Thank you very much, Susan, for giving us that insight. But I see that you have this background as a medical coach. But what type of coaching do you go?
Right. So people come to me that have chronic illnesses. They have gone from doctor to doctor to doctor to doctor. They've been given medications. They've been given, you get 10 minutes with a doctor, 15 minutes with a doctor, 20 minutes. People come to me because they're fed up. They're frustrated. They're sick. No one is taking the time to listen to them. So what I do is I gather their history. I gather their data. I look at labs going back maybe 2 years, or if there are other significant findings. And I have 5 questionnaires in addition to my questionnaires that all my clients fill out. Then based on that, I begin to delve in and look for the missing links. What are the issues that have not been addressed? If someone's got stomach issues, have we looked at the issue? Are they getting probiotics? Do they have candida? Have they been given a lot of antibiotics and then they've got irritable bowel syndrome? So I work in a very comprehensive way with all of my clients. And I look at chronic infections, I look at candida and parasites, I look at airway breathing issues, I look at dental issues. And the list really for me goes on, so that when I present a master plan to my client, they really know where we're going in terms of a nutritional program, support, supplements, and then I also provide specialty labs to my clients that I can ship to them wherever they are in the country, because I work with people all around the country. And then as it's needed, I partner with other functional medicine physicians and to work with them even further. There may be some labs I can't do, but they can do. But diet, nutrients, and truly finding out what are the missing links in the puzzle. So there's, as I say, there's no one doing this in the country. I spend a minimum of 4 hours poring over reports and have spent as much as 10 hours, plus a 2-hour consult. So my work is incredibly detailed. And as I go through the questionnaires, it's incredible what the symptoms overlap. But I'm not looking to put a Band-Aid on these issues. I'm not looking to say, okay, do this and send you on your way. I'm looking to get an understanding, do some of the advanced testing that I do, work with nutrition, work with diet.